So my name's Dr. Imran. I'm the owner here at Cloves Dental Care, Dentistry and Aesthetics in Cardiff. And we've got the full Planmeca workflow in our practice. We were a squat practice which opened in January. We had Wood Lane Dental who helped us to set everything up and all the equipment. And it's been very good. So we chose to purchase the Planmeca ProMax 3D CBCT scanner because first of all there's a lot of choice out there obviously for CBCTs, but we went for Planmeca because you could integrate the workflow into the experience. You could integrate the workflow into the way you work. So everything from using the Emerald intraoral scanner to using the CBCT scanner to using the CAD/CAM milling machine as well. Everything's integrated nicely and it's very simple to use. The ProMax also has the OPT function with it, so there's many uses for both the CBCT and the OPT side of things. And also we wanted to keep everything in-house, so again relaying back to the patient experience side of things, we're able to carry out dental implants, endodontic procedures with all our specialists, everything in-house for our patients, and we don't have to refer out to have scans and things done, which makes the whole experience very much more efficient. So here at Cloves Dental Care in Cardiff, we have an implantologist and we also have an endodontist, and that's where the CBCT really comes into use, because for a lot more complex procedures, it makes things safer, a lot more predictable. Our endodontist, Dr. Cameron Curry, his practice is limited to endodontics, and also our implantologist, Anthony Shepherd. And this whole system with regards to the planning, from the planning stage, the planning of the implants on the using the CBCT equipment and the scans is very straightforward and easy to use. One thing I will say is there is an ultra low dose mode as well with the ProMax CBCT. And this is very good because in these times patients are very concerned about the levels of radiation that X-rays do produce, and it's nice that we're able to, with confidence, reassure patients that we do have a very ultra low dose. In fact, in some instances, I guess a CBCT can be actually lower dose than some of the OPGs as well. But with the ultra low dose mode, it's very simple to use. There's a button on the machine which you simply press and it goes into the ultra low dose mode. So with the technology, we're able to lower the effective patient doses significantly without actually reducing the quality of the image. So we were refurbishing the practice. We set up as a squat in January this year, and we were looking at obviously all the different types of dental chairs that were available on the market. And Planmeca stood out for us because they're a very high technological company, and that's the way things are going obviously these days. The comfort of the chair obviously stood out, the upholstery. They had a variety of different colors, and this was obviously one thing that we wanted to increase the patient experience. So that's one thing which stood out as well, the comfort of the chair. The technology that was involved with the chair as well. So there's many things that can be done with the chair. We went for the Sovereign Classic, which is actually an ambidextrous chair. So we can use it for obviously both right-handed and left-handed clinicians in the future when we obviously employ more associates. That doesn't put us at a disadvantage. There's full rotation, the whole base rotates nicely, so it's very easy to manipulate the chair into different positions. And one thing we also went for is the knee brake option, which is another thing which is great, especially for our older patients, because it allows them to get access into the chair very easily from the door. And also when we're doing consultations and we are sort of showing our patients things on the screens and their x-rays and explaining to them the treatments that are available, It's very nice to sit on a chair which feels like a normal chair and it's not very intimidating. So the knee break style is very good for that, and that's another reason why we went for that. I think we are actually one of the few practices in the UK who have the Sovereign Classic, and it is one of the best decisions that we have made in terms of that. Our patients absolutely love the chair. The comfort is the main thing. When they step into the surgery and they see the bright colours stand out, it really sort of elevates the design of the room, and straight away they feel more comfortable. They have a seat in the chair and they're so comfortable that the sort of upholstery is very sort of smooth and soft. And I've had a few patients who have actually fallen asleep in the chair already, so that's a good sign. And it really gives the patients the wow factor, which is one thing which we really wanted to bring to our practice and to improve the patient experience. So there are quite a few amazing features about the chair, especially this Sovereign Classic chair. We have the self-cleansing function. So our nurses love the feature because there's a flushing system inside the actual chair. So at the end of each session, at the end of each day, it's very easy for the nurses to clean all the suction tubes and everything there at the end of the day. Another thing is the LED light. So it gives the full sort of the dental field is in view, and it's a motion activated, so you can actually increase and decrease the intensity of the light. And also with the motion activation, you can change it to the curing light for when you're doing your composite fillings and things as well. Another thing about the chair is the delivery system. With the continental arm delivery, it's got the pivots on the actual handpiece delivery unit, so it's very comfortable for the dentist, which is another reason why I went for the Planmeca chair, is because the comfort is not just for the patient, it's also for the dentist, and it helps with controlling obviously arm movements, wrist movements there, not to cause problems for you in the future. And the actual delivery unit can be integrated with different sort of handpieces on it, which for Planmeca as a digital leader, it's very good, because we know that in the future there'll probably be a lot of technological advances, and we know that they will have these at the forefront, and we should be able to integrate everything and add on things easily onto the actual unit there. I would 100% recommend Planmeca units to all my colleagues. The installation, the service, the maintenance, and the actual technology is really at the forefront of dentistry, and this is where you need to be if you're going to be delivering the best patient experience to all your clients.